Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Before I get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the top of your screen. We'll have time for them in the end. Only Blum Center staff and the guest speakers will see your questions. Please do not share any personal medical information or questions in the chat box. If you have a personal medical question, please ask your doctor. So next, I would like to introduce you all to our guest speakers today. Joining us today, we have Sandra Elliott. Sandra is a bicultural and trilingual domestic violence advocate and counselor with the Haven program at Mass General Hospital. She has worked with survivors of intimate partner violence for close to 30 years. She previously worked as a training coordinator for the Boston Public Health Commission Domestic Violence Program. Sandra was also an assistant program director at a community-based domestic violence shelter. Joining us today, we also have Reina Burdette. Reina is a domestic violence advocate with the Haven program at Mass General in Revere Healthcare Center. She has worked with survivors of intimate partner violence since 2016 and has been with the Haven program for over 2 years. Reina has experience working in residential and community-based settings and has previous experience assisting with housing, accompanying survivors to court, and facilitating groups. They join us today to give a talk on how to help someone experiencing intimate partner violence. So please join me in welcoming Sandra and Reina.
Thank you, everybody. It's great to be back. Thank you so much for joining us for session number 2 of the 2-part series. Today, Sandra and I are going to talk about how to help somebody who may be experiencing intimate partner violence. Once again, this session, we will talk about some really personal topics and sensitive topics, and to just want to encourage everybody to take care of yourselves in whatever way that looks like for you, if you need to take a break or step away or anything like that. And as always, Sandra and I, or just the Haven team, are available to debrief and or for services as well. Okay, thanks, Sandra. Next slide. So we wanted to start off today by just a little very brief recap of what we discussed last week in our presentation, which was some of the basics of what partner abuse or intimate partner violence might look like. So this is briefly just the definition as well as barriers. For more information and kind of for more in-depth information about these, Sandra did an awesome job describing these barriers as well as the definition of intimate partner violence that we often use in last week's presentation. So feel free to go back and look at that. But just briefly, we wanted to highlight that the definition, at least that we use for partner abuse, is a pattern of power and control that one person establishes and maintains over another person in a relationship. So it can look a lot of different ways. There are many different types of violence, such as like physical, of course, as well as emotional and psychological, isolation, manipulation, everything like that. However, it often just all of these factors contribute to that power and control, and the one person trying to establish and maintain power and control in the relationship. So that's at least just the basis of intimate partner violence and of our work. So also in terms of today, when thinking about trying to support a loved one or somebody that you work with or know who is experiencing partner abuse, we really try to come at it, especially again with the empowerment model, from the trauma-informed perspective. And so wanted to highlight before we even jump into any of that, that there are many, many barriers that somebody might face before, even considering leaving a relationship with abuse. These are really just very briefly some of them, but things like housing needs, especially, we work in the Boston area and housing is a big barrier for almost anybody here. But, the housing wait lists are very long, shelter is very limited. So things like housing, safety concerns, of course, in terms of leaving the relationship, financial, mental health, a bunch are listed there. And like I said, Sandra goes into them in much more detail in last week's presentation, but just wanted to think about that. Some folks really in maybe the best of intentions, but forget some of these barriers and forget some of these factors when speaking to somebody who they know who might be experiencing intimate partner violence. So really wanted to keep this kind of at the forefront of our mind, that there's a lot that we don't know about what somebody's experiencing beyond the relationship piece itself. Thanks, Sandra.
So now we want to talk about responding to disclosures. And I know sometimes when we talk about that particular piece, when we do trainings, it can kind of bring up some anxiety for folks because, we always want to we have the best of intentions, and we always want to make sure that we tell our clients, our patients, the right thing. How do I handle it? What do I say? Am I saying the right thing? So we really wanted to talk to you about that piece of it. So how do you respond to someone who feels comfortable or who trusts you to disclose that they're experiencing intimate partner violence in their relationship? So one of the things to always remember is to respond, to listen to what your patient, your client, your colleague, your friend, whoever is experiencing intimate partner violence, to really listen to them and listen actively, so then you can reflect back some of what they're sharing with you. And you can respond by saying, in a very non-judgmental way, you can respond by saying things like, thank you for trusting me with this information. I'm so glad that you were able to tell me. So they can really feel validated and heard by what they just shared with you. Saying things like, many of the patients that we work with or that we see have had similar experiences as yours, or I'm sorry that this has been your experience. And one of the big ones that always makes a big difference is no one deserves to be treated that way. Really validating the client, the patient, the friend, the colleague, whoever is experiencing intimate partner violence, and disclosing to you. And these are very important. This can actually make a huge difference in terms of what direction the person experiencing intimate partner violence is going to take. Because I can't tell you how many of our clients have said to us, so many people have made me feel like somehow it was my fault. I was responsible for the things that were happening to me in the relationship, and we have to remember that for people in relationships like that, they're already experiencing a lot of shame, a lot of guilt. So our response to them, we have to be very thoughtful and very mindful not to reinforce some of that shame and guilt and the sense of responsibility, because many of them feel like they deserve what's happening to them. So the way we respond, the way we all need to respond, is in a very non-judgmental, caring, thoughtful way, in a very validating way. Something very important to keep in mind.
Yep. Okay, perfect. So in terms of thinking about how to break this down, and thank you, Sandra. I really love those like explicit like wording to give, because I think a lot of folks with whom we speak, do say things like, I don't know what to say, like, what do I say? And really, the basis of it is just to kind of be that like empathetic listening. You don't have to figure it out all right now. But in terms of thinking about the suggestions that we wanted to make to support folks, we wanted to kind of divide it into like professional spaces and personal spaces. So in terms of the professional work, we were thinking about our work in the hospital and healthcare center as being, either like from a provider towards a patient who has maybe just disclosed, or even like colleagues. And, if you hear of something happening at work, but maybe you're not super close with this person. It just like you hear something. And then in terms of the personal relationships, where you're thinking more about a friend disclosing a family member, things like that, especially, we are very aware that we are, kind of in the midst of the holiday season. And so tensions are sometimes high, or just these conversations come up a lot around the holidays. And it's a really hard time for some of our clients as well. So in terms of thinking about the professional space, we always like to start off by saying that it's a good idea to speak in a private space. So if this happens in a hallway or at a front desk or something like that, it's a good idea to try to speak in as private of a space as possible. And just starting from the place of believing the survivor. When we've presented to providers in the past and things like that, we've explicitly said things like, it is not our job to try to figure out like what really happened or anything like that. We really just want to come from a place of believing the survivor, and using the supportive and non-judgmental language back. Some of the examples that Sandra just gave were really great, but just in general throughout the conversation, really try to be that non-judgmental, supportive person in this survivor's life. We also wanted to really emphasize reflecting some of the language and content back in the same way as we talked about last week in terms of some of the language that we used. Haven, at least, we try really hard to not label things unless the person is ready to label them. So even things like relationship descriptions, pronouns, even like what the relationship is like. We are not super quick to label it as being abusive or something if somebody is not ready for that, which we'll talk about actually a little bit later. But also in terms of some of the professional settings, it can sometimes be appropriate to ask about immediate safety needs. If there's like any next steps in terms of if you're a professional or a provider and a patient is disclosing, it's sometimes appropriate to ask about, if there are immediate things that you can do to support. We also just, and we will talk about this, I think, throughout the whole presentation, but really trying to respect the person who is experiencing this abuse, respecting their decisions and timeline over everything. It is very, very easy, and with very good, very well intentions, or good intentions, the best of intentions, that, we really try to help. We think that we know what somebody needs to do. I will say I sometimes fall into this as an advocate as well. After, a few years of doing this, I know some of the things, some of the potential options, but it is really up to the person who is experiencing the relationship to make their own decisions, and just up to us to support in any way we can. And so we also just want to highlight that disclosing or somebody talking about their relationship does not necessarily mean that they want to leave, that they're ready to leave, anything like that. As Sandra mentioned last week, most of the folks with whom we work are in their relationships or still in them and have no intentions of leaving. And that is okay, and that is where we work with them, or just kind of within those bounds. We also just want to highlight, of course, respecting confidentiality, especially in the professional setting with other people and in the medical record. We talk a lot about how to document disclosures of violence and things like that. We're not talking about that this time, but if you have any specific questions, feel free to reach out to somebody from Haven. But also with things like colleagues and stuff, like, thinking about how you act around this person later. And, if you're the person that they have chosen to share this with, that's a big deal, and something that, they really trusted you with this information, and not to, share it, of course, or tell anybody else, as well as not to be like, every time you see that person next, like, oh, how are you? Like, how are things? Or just respecting the confidentiality, using your best judgment in those ways. And then also, of course, in the professional setting, referring to appropriate resources. So for example, if this is a patient, you can have a conversation about the Haven services or refer out or things like that. In terms of the personal relationships, a lot are the same. We really will just kind of highlight throughout the course of this presentation today, using that supportive and non-judgmental language. And again, just coming from the mindset of that you are there to try to support this person. You're not there to impart your wisdom even, or judgment or anything like that. You're there to listen and follow along with whatever they feel like would be most helpful. Something that we see a lot in terms of folks, like folks with whom we work, talking about the conversations with their loved ones, is that sometimes loved ones, again, with the best of intentions and in this very heightened, it is a very emotional topic, but will sometimes center themselves. So for example, get really mad. Oh, I can't believe that's happening. Oh my gosh, I'm so angry about this. I really get really mad or really sad that, of course, nobody wants to hear about somebody that they love going through this. So, these emotions are really, really normal, but we, would recommend folks to try to have kind of other outlets for some of those emotions. And in this moment, in talking with and trying to support the survivor, to center them and their feelings and their experience. Again, kind of trying to maintain the support for the survivor, both in that moment as well as kind of moving forward as well. The relationship might change between you and a person experiencing abuse, but kind of hanging in there with them and making sure that they know that. Again, respecting the survivor's decisions and timeline, as I discussed, in terms of the professional space and confidentiality. Again, kind of not trying to share with everybody else in the family or other folks who know and things like that, but really respecting who and what this person wants in that moment, including who they want to know, especially with the framework that abuse is all about power and control. What you as a supportive person, what we as advocates try to do is give as much power back as possible. Any decision that they can make, big or small, is a win. So really just trying to come from that empowerment place and give them back any sort of power, including, who knows what's going on in the relationship. And then again, like, rather than sharing some ideas or telling somebody what might be helpful, but rather asking and again letting them decide if there are any next steps that they would like to take. Sandra, anything to add?
The one thing I would add, and I've had providers tell me this is very helpful for them to give them that context, is we have to remember that despite someone being in an intimate partner abusive relationship, that there's a lot of courage and resilience and clients in patients, anyone in situations like that are actually very resourceful. And because, they're in the relationship and they find amazing ways to be able to be in the relationship and keep themselves as safe as they can. Whatever little control they have, they'll use that to be able to do what needs to be done to take care of themselves. And I think sometimes that piece gets missed because people look and judge and say, how can somebody so intelligent or somebody so this and that get themselves into a relationship like this? It can happen to any one of us. And since we're talking about supporting anybody who's experiencing intimate partner violence, to remember that they're very resilient, very courageous, extremely resourceful, and that it helps with the non-judgmental piece because you're thinking about it in that frame of mind. So that's the one piece I just wanted to add to that slide.
Yeah, thank you so much. That's very powerful and important. Thanks so much. Okay, I think we're
all right. So expressing concern, and again, I think it's really related to everything that we've talked about so far, the importance of keeping everything confidential as possible. So the piece about speaking privately is very, very important. Also showing that person that you respect their space and their confidentiality. Again, that we can't emphasize enough the the use of non-judgmental language. It's very, very important. And it can literally make a big difference, because I've had clients say to me, I never reached out for help because people always made me feel that somehow it was my fault, that somehow I deserved it because of the way the whoever they disclosed to responded to them, because a lot of the responsibility tends to fall on the person who's experiencing the abuse. So again, that piece is very, very important. And sometimes we say things, again, with the best of intention, because we care and we worry. It's not always something that, because, you know, we live in a society that judges. We live in a society that has opinions. So it's easier to use that than to be, wait a minute, let me stop and really listen to this person and be supportive of them. Active listening, and I know I mentioned that earlier, paying attention to what the person is sharing with you, because sometimes, you know, because they're experiencing something very difficult, they might not always remember, and you might be the person to help them by saying, oh, I remember you shared a similar situation with me. You know, and that's what trauma does. Sometimes people experiencing abuse, again, they're experiencing trauma. So sometimes they might not remember something that they shared with you, and then you can be the one to say, oh, I remember you had shared another situation, a similar incident or a similar situation like that with your partner. So very important to pay attention to what the person is sharing with you. And one of the biggest things, again, never make assumptions. Never make assumptions. It's okay to ask questions. It's okay to ask for clarification. We do it all the time. Haven advocates, we do it all the time, because we don't want to make any assumptions about what the client is experiencing, what the client is feeling. We ask questions. It's okay to ask questions. I think that part of it, sometimes people feel like, oh, I'm invading their privacy, and the fact that they're opening up to you and disclosing something so difficult, it says it's okay for you to ask me questions. I want you to know what's going on with me, okay? And again, allowing people to disclose in their own time, also part of that, very important. And as being a support system, if you want to continue to be a support system to someone, it's very important to use I statement. Always kind of talking about putting it from your own experience, you know, if it's someone you can relate to. And sometimes it doesn't specifically have to be with the abuse they're experiencing. They might share something with you, and then you can say, oh, I experienced the same thing, or I've gone through something similar, or I know how that can feel. So really speaking from your own experience and your own space. It's okay to do that. It's okay to do that, and not kind of telling. And also, it's a way to not tell the person who's disclosing to you what they need to do, or what decision they have to make. And I think that something Haven Advocate, we do very, very often, expressing safety concerns. Sometimes you will hear a disclosure that is feel very frightening, very overwhelming, very worrisome. It is absolutely fine to say, I'm afraid, I fear, I'm worried about what's going to happen to you. I want to make sure that you're going to be okay. So it's okay to express that to someone, that you're afraid for them, that you worry about them. Again, it keeps validating what's going on. And also it shows that you're really paying attention, and you're showing care to what's going on to that person. And of course, one of the most important thing, because earlier when Reyna was talking about the definition of intimate partner violence, she talked about empowerment. We use the empowerment model. So that's why it's very important to respect the survivor's decision, and listening to what they they want to do, what steps they want to take. And I know sometimes that piece can be hard for people who want to be supportive, who are supportive, because sometimes, many times, not sometimes, many times, the person who's disclosing is going to make decisions that you're not going to feel comfortable with, because you're thinking, if it were me, I would do something different. I would make that decision. Again, they know best. Our survivors, our clients, anyone who discloses to you, they know best what's going to work for them, because they're in the situation. They know what they're ready for and what they're not ready for. And that's something to also keep in mind. That's why we cannot tell them what to do, because we are not the ones living what they're living, experiencing what they're experiencing. So that's why we have to pay attention and respect to whatever decision that they make, because they know what's going to work and what's not going to work. And we have to really understand that, because people tell me, how can you just let someone just go back and not tell them? I said, the thing is, I'm not the one who lives with this person. My client, the person who's close to me, they know best what's going to work for them. They know best if they're ready, what they're capable of doing. So that's something I can never emphasize enough. Okay. Again, reassuring them that it's their decision and you will continue to support them no matter what. Like Reina had mentioned before as well, ask what would be helpful. How can I be helpful? Is there anything I can do that can be helpful to you? So, offer help if you feel that it's appropriate, it's applicable. Again, try to use your best judgment. Always, we tell people, sometimes you have to trust your instinct at times, and when you talk to the person, so trust your best judgment. And then when you can, hang in there long term. And I say wait. The reason I say wait, when you can, if you can, because we also understand that this can bring up a lot of feelings for you, the person who's trying to be supportive. And you also need to take care of yourself and continue to so that you can continue to be able to support the person who is close to you. So if some people say, I can only be available for a certain period of time because this is really hard on me, it's absolutely okay to set those boundaries. It's really, really, and we'll talk more about boundaries as well. Setting boundaries when supporting someone who's in an intimate partner relationship. So, but if you can hang in there long term, that would be really, it can make a big difference for the person experiencing the abuse. Even if they are not as much in communication, which means one of the things we talked about last week was the isolation piece, because the person who's experiencing the abuse can be very isolated. So communication is very limited. So you might not hear from them very often. You might not be able to reach out to them in an easy way, but to remember to let them know that you'll be there no matter what. You'll continue to support them no matter what. So these are some of the things in terms of expressing concerns if you have them. Reina, anything you'd like to add?
I don't think so. Yes, thank you so much for that. It's very powerful, amazing. Thanks so much.
All right.
So another thing that we just kind of wanted to mention in terms of this presentation as well are folks who might not identify as survivors. So either both by maybe just not using the language, or folks who maybe you are talking to them and some of the things that they're saying about the relationship that they're in, maybe some red flags are going up for you, but or sometimes it's more blatant and might be like more obvious to you about like, oh, this actually is really some concerning stuff I'm hearing. So you can both so just this is kind of who we're talking about now. So some folks identify or experience different types of partner abuse, but maybe don't think that it is partner violence. Last week, of course, we went into a lot of different types of partner violence, and I think Sandra even mentioned this last week, that folks who might be experiencing emotional abuse or verbal abuse either don't see it or don't know that it's violence, or maybe don't think that it's don't think that it's abuse. Maybe know that something's off, that they don't feel good in this relationship, that they're made to feel guilty a lot of times, or whatever the case may be, but maybe don't see it as abusive. So this is definitely very common, especially when there's no physical violence. And even as Sandra mentioned, we sometimes get calls, or pretty frequently actually get calls from folks who will say like, I don't know about this, or this isn't abuse because there is no physical violence and things. So yes, and then we have to, again, and I know that we have discussed this so many times, but it's because I think this is probably the biggest takeaway from this presentation, is remembering that folks are resilient and can make their own decisions. Sandra, you just said it so beautifully, like they know best. And also as our very wise supervisor often says as well, like folks have been experiencing this usually long before you find out about it. So and have been surviving long before you found out about it. So really just trying to support, and folks can gauge their own readiness to either seek help, to label a relationship as being abusive or not. Sometimes folks never get there, and that's okay as well. But you can validate their folks' experiences without, even if they're not ready to call it abuse. You can say things and be validating and empathetic and empowering, even with or without any sort of labels on a relationship. Again, you can mirror that language. And I think that we talk about this also in terms of the Haven team and kind of like what our work looks like with folks. But I think oftentimes we are also like, we want to use language that folks with whom we work use to us, be it, unhealthy relationship, or even just kind of the descriptions almost of their relationship, rather than actual using the words like abuse or violence or anything like that. And you can still give the information for resources if appropriate. And again, folks can reach out if they are ever ready, or when they are ready. So I think even without some of these labels, we suggest things like almost universal education versus screening. So, letting everybody know some resources available for themselves, for loved ones, anything like that.
So as I was talking about expressing concerns, we also wanted to acknowledge the fact that you might be experiencing some difficult feelings when either talking to someone or working with someone who's experiencing intimate partner violence. And we mentioned some of the ones that are on the list. We talked a little bit about them before, but I think it's important for all of you to see them and so that you can feel. Because sometimes people worry that their anxiety it kind of gets in the way of really wanting to be supportive in the way that they need to be supportive. And because working with someone or talking to someone who discloses intimate partner violence can be a very difficult thing, because we hear some pretty hard, really horrible, horrendous, very difficult things to hear. Because I've had people say, I cannot understand how come a human being can treat another human being this way, and sometimes there are things that the person will disclose, that will make it hard for you to wrap your head around, because it's so hard to hear. It's so painful to hear, and to understand, why would somebody treat someone that way? So the anxiety and the worry, these are normal feelings when you're talking to someone, working with someone, supporting someone, and we wanted to acknowledge that, and that it's okay. It's okay, because it's not always an easy thing. I've been doing this for over close to 30 years, and I still, when I hear what some of my clients are sharing with me, or anybody else outside of my work shares with me, it still causes me anxiety and worry and concern. It comes, and that's the thing. We care, we're compassionate, and we're going to have these feelings. We're going to have this feeling. So I tell people, never dismiss them. Never dismiss them. Recognize that that's what you're experiencing, and that it's absolutely okay. Okay. The other big piece is acknowledging the fact that you're afraid that your own safety can be in jeopardy, and that it's important to recognize that. And also, that's where boundaries sometimes need to come in, because if you fear for your own safety, you have to take care of yourself. You have to set that boundary, because we know people who use abuse, they'll try to again, as part of the isolation tactic that they use, they also try to intimidate the people that are trying to be supportive, or the people that are supportive to the person who's experiencing intimate partner violence. So that's a reality. We hear about it all the time. And sometimes we have people saying, I'm struggling to be supported because I'm afraid for my own safety, because the person who uses abuse has threatened me as well. So because their goal is to make sure that the person that the survivor loses all kind of support and is completely isolated. So recognizing that your own safety can be jeopardized is also very important. Fear for the survivor's safety as well. Safety is one of the biggest things for us at Haven. It's one of the questions we always ask, we constantly assess, we do safety assessment, we do safety planning, because we want to see how lethal, the level of lethality that someone is experiencing in their relationship. Sometimes also it helps us to sometimes we have to tailor the way that we do our work with the client, because let's say the lethality level, we have what we call high risk situation. So how do we manage that? How do we handle that? So that's really a big piece. Especially when the person who uses abuse can sense that their partner is either reaching out or talking to someone, because there's a change that happens when someone finally discloses what's going on, and they can see that because they're so controlling. They can see even if there's a little change, or we have situation where the client feels a little empowered and would respond to their partner, to the abusive partner, the partner who uses abuse in a different way. So they pick up on these little nuances, these little differences. So that fear for the survivor's safety is very, very, very real. And like I said, especially when the person who uses abuse can see a shift, a change of what's going on with their partner. And of course, it brings out frustration and anger. These feelings are so real, especially since we're working with a lot of flawed systems. Systems that are supposed to be in place to help, they're not always very helpful. And it brings frustration, it brings anger, it also brings feelings that why would somebody do something like that I mentioned earlier. Why would somebody treat someone that way? And it's very, and you almost feel also that sense of powerlessness. What can I do? What it just, so even that feeling, the feeling of powerlessness comes with the frustration and the anger. Sometimes anger is because of that as well, because you feel like there's nothing more that you could do to that kind of help out in some ways. Sense of helplessness, again, another word, helplessness, powerlessness, the same thing. What else can I do? What else can be done? What other resources can I provide? How can I really help? So that really, again, it's all connected to the frustration and the anger and the anxiety. So one, usually you can experience all of this. One usually never happens without the other. I always tell people they're very interconnected, and also this could be triggers for you. You can be triggered by someone sharing their experience of what they're going through, reminding you of things that you've experienced in the past as well, or something that has happened to family members. So someone disclosing can be a big trigger for the person who tries to be supportive, or the person who is supportive. So to recognize that, to know that, and again, take care of yourself. And we'll talk about self-care a little bit more, hopefully very quickly soon.
Yes, absolutely. So thanks, Sandra, for the great segue also. So yeah, so here are just some of the many countless ways of that you might be able to cope with some of these difficult feelings, as well as thinking about self-care. So self-care and coping is such a huge part of this work, both in terms of doing the work professionally, so like interacting professionally with folks who are survivors or experiencing abuse, as well as even just like supporting a friend or family member, somebody in your life. It can be really heavy. Of course, we want our people to be with good people. And, of course, all of those feelings that Sandra talked about in the last slide are very normal in terms of trying to hang in there with somebody. But here are just a few, like I said, of many ways that you might be able to cope with some of these. So things like supervision and training, especially in those professional settings, learning more about intimate partner violence and what you might be able to do like this. Seeking professional support. So this is maybe on more of a personal level, like if you personally need to, find somebody like a therapist or something like that to be able to cope. Especially in terms of MGH providers, we're always open to even consultation or even just a debrief. We don't even necessarily need to know anything about the situation, the person's name, anything like that, but we are open to just listening. It can be really, really difficult to sit with some of these stories. So, we're always open to doing that. Getting more a little bit into the kind of self-care realm, but things like practicing mindfulness and or meditation, if you choose to do so. Again, kind of just trying to check in with yourself about what usually helps you support yourself. Using a support system, so talking with other members of your friends and family or just loved ones to seek support informally as well. And then also just sometimes, again, kind of in terms of the self-care and what might work for you, but having more of a healthy lifestyle or enjoying some of those healthy activities or healthy coping skills can go a long way in terms of trying to cope with some of the things that you may hear, again, either professionally or personally. And then Sandra mentioned this as well a few slides ago, but setting boundaries, again, both personally and professionally. I always say that I think boundaries is like a lifetime process. It's a muscle that will get stronger, sometimes a little weaker as things change. but thinking about boundaries and what you can and can't provide for folks, and trying to be honest about that, again, both personally and professionally. But it's absolutely okay to set your own boundaries around, when and how you can show up for folks. And so it's absolutely okay to think about yourself and to prioritize your own needs as well. If you feel depleted, not a lot of super helpful stuff sometimes comes from that. So so setting those boundaries and trying to take care of yourself as best as possible.
Mhm.
Sandra, anything to add?
The one thing that I would add, especially around the self-care piece, it's okay to say no. It's one of those things that when people are experiencing what they're experiencing, they constantly, sometimes they will be calling you in the middle of the night, for instance, or needing something in an emergency, and I've had family members, colleagues saying, oh my God, I'm exhausted, I'm tired, this is kind of taking a toll on me. It all has to do about setting boundaries, but I wanted to specifically put it out there and say it's okay to say I can't do it right now. I'm still there for you, but I'm exhausted. Can we do it? Can you find somebody else? Again, sometimes people need that, a little redirection. Can you ask somebody else to do it? It's okay to say no, that you don't have to take everything in, because you understand that this person is in a very difficult situation and that they can need you 24/7. Because if you cannot provide support, yes, we said to hang in there long term, but it's also important to take time for yourself, to really take time for yourself so that you can continue to be supportive. Because I know some people have told me they feel really bad saying no to a close friend or a colleague or a family member, and we have conversations about that. So I wanted to specifically put that out. Okay.
So finally, and in our last few minutes, we only have a few minutes left, but we were not able to get to the slide last week, so hoped that we had a few minutes left before the question session, and it seems like we do. So again, just in terms of thinking about supporting somebody, we wanted to mention a few of the ways that COVID-19 may have impacted this population differently even than the general population. Of course, everybody is very impacted by the pandemic in a myriad of ways, but here are just some of the ways that it might specifically impact folks who are also experiencing violence. So COVID-19 in general, as we know, impacts populations that are already at the most vulnerable, survivors being one of those populations, as well as, of course, in terms of the different identities that survivors hold, such as age, race, sexual identity, sexuality, gender, things like that. It might impact folks differently as well. We also, safety planning looks different now, depending on whether folks are home or in the office or things like that. It's very different, as well as even just our work with folks and talking to people is different. There are, of course, financial and psychological impacts to living through the pandemic. Of course, also resources and access to resources has looked different. Some places are strangely easier to get in contact with, but most are more difficult these days to get connected with some of our local resources. The systems that a lot of survivors interact with, things like court, DCF, and DTA, look very different, with most people being remote. And then even things like finding childcare for working or medical visits, again, these are things that have impacted everybody, but impact survivors a little bit differently. And then, feeling free to, as always, reach out to Haven for more information and resources. So that was very, very brief. Of course, we could do a full 3 hours about just IPV and COVID-19, but very, very brief. But I think we already have a few questions to get to. So I'm looking forward to having some discussion here.
Yes, definitely.
Sandra, maybe stop sharing or stop screen sharing, and then we
Okay.
can. This is, of course, our phone numbers, but readily available on the website and things as well.
Thank you so much, Reyna. Thank you so much, Sandra.
You're welcome.
I can,
How do I? There you go.
Got it.
Thank you. Thank you. I was like, how do I get rid of it? There
of
you
course.
go.
So we are now toward the end of the session. If you have any questions for Sandra or Reyna, feel free to enter them in the chat box. So I do see that we have a couple.
Mm-hmm.
Do you find that you have to shift or change your tactics for other populations, for instance, men, among population where, you know, it's not as talked about broadly?
We really we assess everybody the same way. It doesn't matter whether, whatever gender we work with. We ask very specific questions. We talk about their experiences. We ask about their experiences. We ask them to give us examples of what they're dealing with, of what's happening with the partner. So to us, there's no difference in the way that we approach or we assess what's going on with the client, whether, again, whatever gender they are, really what we want to get to is this, first of all, is this an appropriate resource for them? And then how can then, from the information that they share with us, how can we continue to do the work? What are going to be some of the goals? What are going to be some of the steps? So that's the things that we look at. So we use the same assessment for everybody. We tweak it a little bit, but it's pretty much the basis of it is the same. It's the same.
Yeah, I think that being said, we definitely take into account the identities that folks
Yep.
hold and the way that they impact the relationship as well. Yeah, so for example, when working with folks who are, not cis women, there might be increased shame, especially with men. There might be higher shame. There might be, not being believed by systems and things like that. So definitely the identities that folks hold really impact their experience of abuse. And so we really try to take that into consideration, things like cultural and race identities as well. The list goes on and on. So it definitely impacts the work. But as Sandra was saying, the basis of the work and trying to empower and assess continually, that those things stay the same.
Thank you. Are there any words that we should stay away from when speaking to someone about abuse? For instance, using words like should, any words that may seem judgmental that we should avoid?
That's a hard one to answer because it's there are so many different things you can say and not realize that it's actually it can be shameful, or language is so important and people hear things differently. So I think to keep in mind that the best thing is to kind of reflect back the language that the survivor is using and to go with that and to validate and I think that's it's the easiest way to kind of so that you don't get into using the wrong. I don't even like to use the wrong words or say the wrong word, because again, you have great intentions, you want to be supportive, but definitely following the survivor's language is very important, and really taking it from there, because people will say things with, they mean well, but the way the survivor hears it, it feels very different, so just to be aware of that. Yes, and it's okay to say, I'm not sure, I'm not sure if what are some of the right things for me to say. I don't want to make things worse. I don't want to sound judgmental. It's okay to acknowledge that as well, that you don't know how to say or what to say. Survivors are very understanding, very, very understanding. You don't have to have all the right words, because even sometimes I say something and I'm like, wait a minute, I could have said it in a different way, recognizing that, we're not always going to say the right thing, and saying that and letting the survivor know, oh my God, it came out, this is not what I meant to say. I'm really sorry about that. I wasn't sure how to say it in a way that sounded supportive. Again, owning up to it, it's very important, and then sharing that with the survivor. They would prefer that than not you acknowledging and then kind of continuing the conversation as if nothing happened. Yeah. Mm-hmm.
Yes, I totally agree. I think I tried to make an attempt at answering this. I think, as Sandra was kind of getting at, it's easier to say some of the do's maybe than some of the don'ts, just because. But I think, as even the comment mentioned, things like judgmental language, of course, if you yes, absolutely try to avoid that. Same thing with language that might even inadvertently, but turn blame back around. I think shoulds in general, if you can avoid them, ironically should be avoided. And even sometimes I have tried to stay away from even things like why questions, and instead try to reframe using what or how. But it is much easier to say some of the do's rather than we don't have a specific list of words. I think just in general trying to use that non-judgmental and supportive language. And just wanted to emphasize what Sandra said about taking accountability for if or even when you say the wrong thing or something that comes across incorrectly, or something that was judgmental, or making assumptions or things like that. I think it's really, really important, especially a big part of a relationship with abuse is that there's absolutely very limited accountability from the person using abuse. So again, just kind of modeling that, I can't, I will hold myself accountable, and I'm sorry I said the wrong thing, or I am sorry that I hurt you. Really just trying to model that accountability and taking responsibility for your actions in a way that maybe this person, depending on the situation, does not get too much in their relationship, unfortunately.
Mm-hmm. Thank you so much. So I have one final question. Is there a contact information we can share with folks who want to reach out to Haven for services?
Mm-hmm. Mm-hmm. So Monday to Friday from 8:30 to 5 to call the Haven main number, which is 617-724-0054. And we can add that information to the chat. And also, we actually, if you go on the MGH website and you type Haven, we have our website in there as well. So folks can find us in different ways. And during those times, every day there's an advocate on call. One of us is on call. So if you call Monday to Friday, 8:30 to 5, one of us will, if we don't answer the phone, it's safe to leave us a message, and we'll be happy to call anybody back. After hours, we don't have anybody answering the Haven main line, but you can ask to have the covering social worker paged. So you can call the main hospital number and say, I'm looking to connect, or, I need some information around intimate partner violence resources. Can you please page the covering social worker? And they'll do that. And that's between 5 and 8:30. And on weekends, because we also are not here in person on weekends.
Thank you so much.
Okay.
Before we end today's session, Sandra, Reyna, any last final thoughts you'd like to share with the audience?
No, thank you so much again for being here and for those awesome questions.
Yes, yes, yes. I completely echo what Reyna said. It was a pleasure to do this presentation. And please do not hesitate to reach out to us. If you have any more questions or concerns or you need any more information, we would be happy to answer them.
Thank you so much. Sandra, Reyna, thank you for a lovely presentation. Everyone, thank you so much for taking the time to join us today. Hope you found it helpful. As discussed, the recording will be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely
Thank
rest
you.
of the day.
You too.
Thanks. Bye.